Since 1997, 4 cooperative research centres and the Lowitja Institute have demonstrated what can be achieved when Aboriginal and Torres Strait Islander cultures, knowledges, priorities and leadership are at the centre of the work to improve the health and well-being of our First Peoples. Guided by key principles and with the support of our many partners, we have contributed to a significant body of knowledge and have earned a place of cultural authority in the health research sector. We have built a significant legacy, gathering supporters, partners and a network of researchers committed to our mission, values and methodology. That effective health research requires a process that reflects community priorities.
Since the beginning, the Lowitja Institute has built a sound reputation and national presence in health and wellbeing research. The Institute has received recognition for its contribution to creating networks and dialogues that put Aboriginal and Torres Strait Islander leadership and knowledges at the centre of the work. Key to that has been the development of a new way of working. We have brought together the Aboriginal and Torres Strait Islander health sector and communities, researchers and practitioners to identify areas where research is able to make a real, measurable and positive difference. We have changed the narrative of how research in Aboriginal Torres Strait Islander communities is done in this country.
The early conversations about finding a new and more effective way of doing research occurred in the early 1990s, a time of growing advocacy and independence for Aboriginal and Torres Strait Islander organisations that saw health research, culturally appropriate research, as a rights issue. We always wanted to be an Aboriginal and Torres Strait Islander community-controlled national research organisation. This vision is now a reality embodied in the Lowitja Institute.
Community control has been embedded in our new constitution. This change allows us to privilege our own mob when it comes to allocating research funds and will ensure Aboriginal and Torres Strait Islander people drive our research agenda more strongly than ever. Another important step towards community control is the establishment of the Lowitja Institute members community. The member community will comprise of a core group of people and organisations with the drive and ethics to make a real difference to the health and well-being of First Nations peoples. It will support Aboriginal and Torres Strait Islander priorities, collective ways of working, strength, agency and knowledges. The member community will ensure that we continue to be an authoritative and collective voice for the benefit of Australia's First Peoples.